Hello, I'm Dr. Jonathan Cohen, and what I want to do is talk to you about the history as well as mechanism of action of these neurotoxic or neuromodulator drugs that are used in facial aesthetics. Those include Botox, Xeomin, and Dysport. Now, I don't want to bore you with the intricacies of the biochemistry and physiology of how they work, but what I want to do is I want to give you enough information that you feel comfortable with how they work, feel comfortable with their safety profile, and also feel comfortable talking to your patients about their safety and about the mechanism of action if they ask you. So what I'm going to give you is the minimum amount that I think that you should know to feel comfortable using these drugs. Now, the drug that you hear most often, of course, is Botox. These are from a particular bacterium, Clostridium botulinum. And as you may or may not know, that is associated with a disease called botulism, whereby that drug produced a toxin that is very similar to the toxin that is in these drugs. And that caused a number of side effects. One is, that is probably not surprising because they're used to paralyze muscles in facial aesthetics, is that it causes muscle paralysis. But another interesting side effect was that it also causes effects on the parasympathetic nervous system, that system that causes you to sweat, causes you to produce saliva. And so the effects of these drugs can be used to not only modulate that muscle action, but they can be used to modulate the effects on the parasympathetic nervous system that I just mentioned. So each of these drugs is derived from botulism toxin serotype A, and there are various formulations of that have very similar effects, but can have a little bit different efficacy in terms of how quickly a patient responds to them. And they're also useful to have them in your armamentarium if, say, a patient has a reaction to one, then you have another one that you may have available that you can use. Now, as I mentioned, these are all from Clostridium botulinum serotype toxin A, and they're all derivations of that, whether it's incobotulinum toxin type A, or Xeomin, or onobotulinum toxin A, or Botox. They all prevent the release of the neurotransmitter acetylcholine at the neuromuscular junction. So at the junction between the nerve and the muscle, they prevent that release of a neurotransmitter, and they do it by binding to a set of proteins that are in your body called snare proteins. And you can think of it like the snare proteins are grabbing that acetylcholine neurotransmitter, putting it into vesicles, and pushing it out at that junction. So by stopping that mechanism of action, by stopping the snare proteins, you're actually preventing the release of that acetylcholine. Now, as I said, they do it at the neuromuscular junction, where we often think of Botox or these neuromodulators being used, but they also do it at the neuroglandular junction. So the first use of these was actually derived, or thought that it could be used for treatment of both strabismus, lazy eye, but also something called blepharospasm, which is a twitching of the eyelid or a myoclonic twitch of the eyelid. And it was shown that these drugs were extremely effective. So put yourself in this scenario. You have blepharospasm or an eyelid twitch, and you go in and you get a neuromodulator or neurotoxic drug to paralyze that muscle, Botox, and you leave and you notice that the lines on your forehead or in between your eyes are gone. So that's how these drugs were discovered to be used for facial aesthetic reasons. Those patients were injected for these drugs for other purposes and then came and said, gosh, doc, my blepharospasm is gone, my lazy eye or strabismus is better, but can you inject me a little bit earlier because I feel like I look younger? And my husband said, I look younger. So that's how these drugs came to fruition for being used in facial aesthetics, and that's how we use them frequently today. So in mentioning those forehead lines and in mentioning their association with the eyelid twitch or blepharospasm, that's the first thing that these drugs were utilized for, and they were initially FDA approved in 2002 for the glabellar lines or the 11 lines between the eyebrows as you make that stern look on your face. Then I mentioned the parasympathetic effects and the excessive sweating. They were approved for people with hyperhidrosis or excessive sweating by injecting this neuromodulator into the dermis of the skin, either under the arms or in the hand or in the feet. Then it was noticed that people that have migraines tend to have some muscle tightness and a component of tension headaches associated with their migraines, as well as trigger points, and it was approved for chronic migraines in 2012. And the list just keeps going on what these were approved for. Eventually, as muscles, it was discovered they could be used selectively on almost any muscle of the face. They were approved for the crow's feet, or the lines out of the corner of the eye, people with overactive and spastic bladder, forehead lines that are above those glabellar lines. And as they were FDA approved for all these uses, there were other off-label uses that ingenious physicians and practitioners discovered that they can be used for, including the bunny lines on the nose, lifting the nasal tip, vertical smoker lines around the lips, dimpled chin, bands of muscular tissue, platysmal bands in the neck, as well as reducing the size of glandular or muscle tissue. Like if someone has large masseters or parotids, these compounds can be injected in there and produce the acetylcholine blocking effects that have either paralyzed muscles or reduce the size of glandular tissue, like people that have excessively large parotids or parotid tissue. It will reduce the effects of those. So that's the basic mechanism of action of these drugs. And as you can see, it can be used in many parts of the body, but is primarily used in the face and with facial aesthetics. I'm just going to talk for one moment about contraindications, both absolute and relative contraindications for these drugs. One is there are some people that occasionally have allergies to various components of the drug or develop allergies to these drugs, and that would be an absolute contraindication. There are some people that just develop antibodies to them that reduces their efficacy, that reduces their ability to bind to those snare proteins, and then they're not as effective anymore. If that is the case, one of the advantages of having 3 different types of these drugs is frequently you can just switch to another brand and relieve that. You do not ever want to make any injection in the site of anybody that has active infection. If someone is extremely prone to scarring when they've had injections prior. In addition, these drugs have not been shown or studied to be shown to be safe in pregnancy, and so they are listed as a category C for pregnant mothers and breastfeeding, so they just should be held and not utilized during those times. Now, relative contraindications are people that already have muscle paralysis or a muscle weakness or fatigue syndrome. So the first one that comes to mind is myasthenia gravis. If someone already has eyelid weakness or facial weakness or a history of myasthenia gravis, you should be extremely cautious about injecting Botox because it can exacerbate that. So those are some of the absolute and relative contraindications. That is the mechanism of action, and that should be enough information that you can really give your patients to make them feel comfortable with this. Again, I just want to stress that I like to call these drugs neuromodulators and not neurotoxins. And that is because in the doses that we use, both for muscle paralysis and preventing the effects of the parasympathetic nervous system, they're really not toxins, and they've been shown to be very safe. They just affect the release of acetylcholine. They do not cause the death of tissues, and so they are very safe drugs for your patients.